All right, welcome everybody. I'm Jen Nazareno. I'm a faculty member at the School of Public Health, as well as the Nelson Center for Entrepreneurship. I am also the Interim Associate Dean for Academic Affairs over the School of Professional Studies. And we, alongside with Raymond Che, who will be introducing himself right after me, are moderating a conversation around navigating and the journey to medical school. We wanted to host an event, a webinar particularly, where students can learn from their from other Brown alum and how they got into medical school, many of which are also first-generation students. So we want to offer support as well as be a source of resource, a resource for students that are currently planning or thinking about applying to med school after Brown University. So Ray, if you wanted to go ahead and introduce yourself, and then we will then introduce the panelists, or the panelists will introduce themselves.
Hi, everyone. My name is Ray. I am a second-year MPH student. I am currently the chair of Master's Advocacy on the Graduate Student Council, and I'm also interested in pursuing medicine. I'm applying to medical school this year, and I actually just got my first acceptance to the University of Texas Medical Branch over in Galveston. Jen and I have worked together, and we wanted to host a panel of like this to provide resources for students at Brown, whether they're graduate students, undergrad, or at any level, to hear from other people about their experiences. And if they wanted to pursue medicine, then understand how they might go about that.
Great. I'm going to turn to you, Maria, if you want to introduce yourself and your career at Brown, as well as what you currently are doing right now.
Sure thing. Hello, everyone. My name is Maria. I graduated from Brown University in 2017 with a degree in neuroscience. I took some time off. I can talk about that a little bit more later, but I then went back to Brown to complete my master's in global health. And now I'm almost at the end of my first semester at George Washington University's medical school. Jen, you're muted.
Great. Sorry, thank you for that. Great. Natalie?
Hi, everyone. I'm Natalie. I graduated Brown in 2021. I concentrated in public health and public policy. So I'm a bit of a non-traditional student / applicant. After Brown, I worked for a year at the United Nations Population Fund, and I loved it, but I thought medicine was the one thing that I kept coming back to and thinking about. So now I'm pursuing a post-bac at Columbia, and I'm currently applying to medical school.
Wonderful. Rama, if you could go next.
Yeah, hi everyone. My name is Rahma. Currently I'm a first-year medical student at Cornell, but I graduated from Brown in 2022, where I studied immunobiology and public health. And I'm very excited to be here and answer all your questions and give whatever advice I can.
Thank you. Melissa?
Hi, I'm Melissa. I use she, her pronouns. I graduated from Brown for undergrad in 2020 with a degree in biology, and then I continued at Brown at the School of Public Health. I got an MPH and I concentrated in global health, and I just graduated back in 2022. And now I am a first year at the University of Maryland School of Medicine in Baltimore. And yeah, I'm so excited to answer anyone's questions.
Great. And last but definitely not least, Andreas?
Hi, I'm Andreas. I am currently a third-year resident in family medicine in New York City at Mount Sinai Hospital. I graduated from UC Berkeley in 2014 and then took some time off and then went to Brown for med school and did the combined MD and master's program in primary care population medicine. And I graduated from there in 2020. And Dr. Nazareno was my research mentor throughout med school. So that's how we met. And we did a lot of work together. So very happy to be here. And thanks for inviting me.
Well, thanks everyone for being here. So let's get into it. So one of the first questions one of our students asked was, what would you recommend doing during a gap year? So any initial thoughts on that? Research, traveling, volunteering somewhere? Yeah, sure. Go ahead.
So so when I graduated, it was 2020, and then that was like right when COVID happened. And I had actually planned I had a job lined up for research. And I don't even remember what it was in at this point, but that kind of fell through because it was just like specifically with elderly populations. So I didn't know what to do. I had thought about getting an MPH like forever, but I wanted to do it as a dual degree when I was in med school. But I decided, like, since I had these 2 years anyways, I had set them apart. I wanted to have a gap year. I decided like, oh, this might be a good time to pursue that because I'll have more time. Like maybe I'll find something within public health I'm really, really passionate about. And I didn't know. That definitely isn't like the go-to. Like I was doing other things. I was volunteering and that was really, really meaningful to me. I was doing a lot of advocacy work within like my local community, especially because of COVID. I'm from South Dakota. So that was really like enriching, just being able to like work within a community I knew. But I would suggest if you are like considering it at all or like thinking like, I don't know, maybe I'll pursue a graduate degree or whatever, definitely don't do it unless you're interested. But I have said it like a million times, getting an MPH was the best decision I ever made academically. It genuinely changed like my whole direction in medicine. It like rejuvenated everything. It made me so excited to see what I could do with it. And like even now, my friends in med school, like all the time, they're like, "Oh, did you get an MPH?" Because I like tell them every day that I'm like, "When I got my MPH, this is what we so yeah, I like kind of think outside the box on like what are some interests I have that still kind of fit within that realm of medicine, but I really want to spend time exploring. And yeah, I think for me that was just public health in general. I hadn't even considered it, but if I could go back and do it again, I 100% would do it again. And maybe just explore other areas of research because it was just so wonderful for me.
Thank you, Melissa. I want to open it up to the other panelists. Any thoughts on what would you do? What would you recommend to do during a gap year?
I can speak on it because I took 5.
Great.
So yeah, so I graduated in 2017. And when I came into the medical path in sort of a whirlwind, it's not what I had planned on doing when I entered Brown as an undergrad. So when I graduated, I needed to get clinical experience. I worked as a medical scribe in the emergency departments in a few hospitals in Rhode Island, spent a few years doing that, I think maybe 1.5 or 2. While I was doing that, to supplement my income, I worked as a tutor, which really built my teaching skills. And then over time, I quit my scribing job. And then I said, listen, I need to do I need to work in research. I've never done that. And so I worked as a research coordinator for, if y'all are familiar, the Wharton Neuroengineering Lab. It's within our, I think it's in our engineering. Yeah, it's within the School of Engineering at Brown. Was there a question? Okay. And so I learned the back end of research through that. And when I say the back end, I mean like the financing, the regulatory aspects, and really how to manage projects. And then I said, I want to do research on the front end. And that's when I entered my master's year at Brown. So all in all, that took about 5 years of my time. And if I could give folks advice on how to navigate the number of years or however, when it comes to your med school application, I would suggest that you are very, very intentional and very clear with yourself as to why you're going to take those gap years off. If you plan on taking several, I can assure you that it doesn't hurt. I have met so many people here, at least at my school, who have taken more than 2, more than 3. A friend of mine has taken 10. So it can be quite a grab bag in medical school.
Maria, did you know as an undergrad that you wanted to get into med school? Did you know that, or was that eventually over time that you're definitely going to get into and going to go to med school?
Oh, that's a great question. In undergrad, I came into Brown believing that I was going to be a corporate lawyer. So I changed my major 5 times. I wish I were joking when I say five. Five seems to be my lucky number here. And it was it was really in my junior spring that I began taking serious pre-med requirements. And because I crammed very many of the pre-med requirements in my last 3 semesters, I really didn't have an opportunity to sit and think about what I really wanted in med school. All I was thinking about was getting there. That type of thinking did not serve me because when I applied right out of college, I did not get in to any of the schools that I applied to. I must have applied to, I don't know, 30. And so that's another thing that I would have told my younger self is don't rush, do not rush. If you do not feel ready, if you have a shred of a doubt that you're, not ready, then take the time to get ready. You are on your own timeline. So I hope that answered your question, Jen.
Yeah, no, that was great. And thank you for just being so open about the process and everything you've gone through to get to where you are now, which is a first-year medical student. So thank you for sharing your journey. Natalie, I know that you're currently in a post-bac. Can you just, did you take a gap year, or how did you realize that, because I knew you worked at the United Nations and now you're at Columbia. Did you always know you wanted to get into med school, was it similar to Maria, where it was over time that you realized you wanted to apply to med school?
So it was a bit of both. Like I came into Brown kind of shopping a lot of classes. And then I fell in love with public health. Like during my sophomore year, I took so many different classes that I was like, wow, this is my one true passion. So then I studied abroad in Switzerland in a global public health program. And then I learned what the United Nations Population Fund is, which for those of you who don't know, it's an organization that works to improve sexual and reproductive health around the world. So I worked with them. So that was my goal. My immediate goal was like, I want to work for this organization after graduation. So I did all of the steps to do that. I studied abroad. I did research. I was like, a public policy major would come into a lot of use for that as well. So I did all of that. And then I began work after college there, and I loved it. But then I was thinking of my next step and where I wanted to go. And I realized that I kept getting drawn back into medicine somehow. So then I decided to pursue the post-bac. So a little bit different.
Okay, thank you. Thanks for sharing. Andreas, it sounds like you took some time off too. Is that correct? Right after Berkeley, or did you go straight? I feel like you did. Did you go straight, or did you take a little bit?
I took time off.
Yeah.
So I, like Maria, I worked, I was a research coordinator. I worked at UCSF. And I think I would echo the sentiment that while you're in college and you're surrounded by other people who are very aggressively pre-med, it may feel like you should also be that way. And you should pay attention to the things inside of you that indicate to you that maybe you're built a little bit differently, or approaching your career a little bit differently. So I think after taking time off made me feel very comfortable about kind of like my own path and my own way. And I recommend it if you have any of those tendencies, or if you feel that way, or if you're still trying to kind of construct your ideal future. So that allowed me the space to do a lot of things, to think about what I wanted, to work in an environment that it was a medical environment. So I was able to work around academics. I was able to work around physicians. I got to really see kind of how people approach their work. And it also, the schedule was flexible enough that it allowed me to study for the MCAT and allowed me to apply to medical school and work on my applications, also have an income to support myself in paying for applications and also paying for things like interviews back when they were in person. And so I think for me, it was an ideal time. And also, I don't think the value of being a working person at a young age can be undersold. I think it's a really important thing to do when you're in your 20s, so that when you are a physician, it's not your first time working, and you're not caught off guard by some of the intricacies of being employed, because there are many. So yes, I think it was fruitful in a lot of ways, and it also, working is a little bit different than being in school. Your job ends at the end of the day, and I think you get to enjoy your life and experience your life in a different way than you do when you're in school. And I think for me, it was very valuable. So yes. And you also just make a lot of connections depending on where you're working. And you can kind of continue to build relationships that can be supportive to you, hopefully, throughout your applications and throughout your career. So I'm still in touch with so many of the people who I worked with, and very, very often run into them as co-residents in the emergency department. This has happened like 4 times since I've moved to New York, that I see somebody and I'm like, oh, we worked together in San Francisco, 7 years ago.
Thank you, Andreas. Rahma, I know that your path is a little different. I think you went straight from undergrad into medical school. Correct me if I'm wrong, but I think that was your path. Can you give us that perspective?
Yeah, definitely. I think that over time, going straight through has definitely become the less popular / less common option. So even in my own class, there's 106 total students. I would say 10 of us total went straight through. So it's definitely the minority in that sense. But I think what's really important, which is what one of the panelists said earlier, is that the key is to apply to medical school when you're ready. And if you are ready by junior summer, which would be when you'd be applying if you're going to be applying to go straight through, then you should apply if you feel ready at that point. And you should not let the narrative that like more people are entering later on deter you from applying at that point. So my advice would be figure out if you're ready. And the way that I was told to figure out if I was ready, because I was very undecided about whether or not I should take gap years, because it seemed like taking gap years was the better, more advisable route to go, was readiness comes in 3 forms, was what I was told. It comes in being ready clinically, so having those experiences clinically that show you that medicine in the clinical setting, which is, predominantly what it is what you want to do, and you have experience and understand what it's like to be in that sometimes emotionally difficult setting and know what comes with that. Then it's also being academically ready, is what I was told. So that is having your MCAT, having your GPA and all of that settled, and is putting your best foot forward with whatever scores you have. So if you don't feel like your undergraduate GPA is reflective of that, considering a post-bac. If you don't feel like your MCAT is reflective of that, considering taking it again, and that might postpone you applying straight through. And the third form of readiness that I was told to consider as someone who is going to be applying straight through was readiness. You're like, as with you as a person, do you feel ready mentally and like support wise, whether it be from your family or whatever is going on? Do you feel ready as a person, as a like 21-year-old or however old you are at that point in college, applying at that point? So if you feel like you're ready in all 3 aspects, and again, this is advice that I was told and it worked well for me, then you may be ready to apply straight through. So it's just all about figuring out if you're ready or not. And I feel like rather than thinking of, should I take a gap year, should I not take a gap year, think of, am I ready to apply straight through, or am I not ready to apply and like want more time to build other aspects of my application or other aspects of my life before I feel ready to commit to the medical career.
Thanks, Rama. I really appreciate that overarching question of asking yourself, are you really ready? And more than if you should take a gap year or not, but just, are you ready for that next chapter? But part of, another huge decision or big part of that is navigating the financial aspect of applying to medical school. So one of our students asked, what helped you the most in guiding your application process without having, in case you didn't have family members, close family members in the medical field? So first, the question is, how did you navigate the financial aspect? And another follow-up question to that is, in terms of the application process, if you're the first in your family in med school, how were you guided? Did you get support that way? And who helped you? So let's first start with the financial aspect. Could I turn to Melissa for had any thoughts on that?
Yeah, so I was very fortunate and I had full support from my family, from my parents. Also, a majority of my application was I like worked, I guess, through college and grad school, but it was just like TA jobs and everything like that. My parents have been very, very supportive of my education, and I've been really fortunate of that. So I was able to use that um, money that I had saved up to pay for my applications. I was still like pretty careful about not applying to too many schools just for the sake of applying to schools. Um, I think I like capped it at a certain number. But yeah, I was very fortunate in that, so I can't speak too much on that.
Okay. How about Maria? How was your experience?
I have to think back to both application cycles. When I had first applied, I was working as a medical scribe at a very saucy $12 an hour. So I definitely was able to get support from my parents for a bulk of that cost for the first time I applied. And I think, yeah, I think I did. I said I applied to 30 schools. The second time I applied, I had a few years of work under my belt because after I graduated from college, I always worked 2 jobs at least. So I was putting away half of my paycheck and just building those funds over time. And it was through that I paid for my second round of applications, and I did cut down. And I think I applied to like 15 schools the second time around. You get tired. So yeah. I think that there was still some form of support that my parents lent me in that second time, but it was a fraction of what they had put in for the first time.
So how did you balance working 2 jobs, you said at times, and applying to, and you were in graduate school as well. You were getting your master's in School of Public Health. I was one of her mentors, so yay, Maria. But then how did you balance it all? How did you balance like the 2 jobs, the being in graduate school and also applying and taking your MCATs?
Yeah, that's a great question. That my master's year was incredibly challenging because of how much I had put on my plate, and I can very much in a moment of honesty, I can tell you that I did not always manage it well. For the most part, I did not manage it well. It was very much at the cost of my rest. So that's like the biggest lesson I learned in my master's year was to say no. Because so much of what we have to do to be on the pre-med track to get into medical school is that we have to say yes to a lot of different things. Yes, I will keep working. Yes, I will do this leadership opportunity. Yes, I will do this volunteer opportunity, and so on and so forth. And so we don't get to practice no very much. And so I think that there were some ways that I became strategic so that I don't so that I can manage my time. Tutoring was a really great gig for me because it was a way to make more money for less time. And then something that I also did was for the research opportunities I took on, I wanted to make sure I was paid. Actually, for my master's thesis, I was a research assistant for that project. And so I was like paid essentially to do my thesis, which was really nice.
Yeah, great. Andreas, how did you balance the financial aspect of applying to med school?
Yeah, so I think one fortunate thing was I'm from California, so I went to a state school. And so immediately the cost of education is significantly less than, say, going to Brown. So that is helpful just kind of as like pretext. And then having kind of stable employment in the years that I took off, I was working in San Francisco, so I was making some amount of money that would conceivably allow somebody to live in San Francisco, but I didn't live in San Francisco. I lived in Berkeley, which is considerably cheaper. And I also shared a house with 5 people. So I lived like a person who's, 22 years old and sharing a house with 5 people. It was fun. It was also much cheaper. I also didn't have a car. I just rode my bike. And so the day-to-day of my life was fairly inexpensive. And it allowed, or kind of strategically organized so that I didn't have a lot of out-of-pocket costs kind of every day, which allowed me to kind of more stably support the applications, support the flights, support the hotel stays, whatever it was, with whatever I was making, which was not a lot, right? Like a research coordinator job is not a lucrative job. So it was a little, I had to be a little bit creative in terms of how I was using my own finances. And then because the finances, once you get to medical school, the story kind of changes a whole lot as you take out loans to be in medical school, if you do. So yes, I think also having a job that had insurance minimized my costs of medical care and dental care and eye care, these kinds of things, which I think are maybe not like immediately obvious to a young person, but those can be significant costs depending on kind of what your needs are. And if you have insurance and you have coverage, then they're no longer costs, or they're significantly curbed. So thinking about things like that, if you're in a situation where that like constellation of things matters to you, how do you position yourself to have a job or a role that allows you to kind of offload some of your fiscal obligations, if that makes sense.
Thanks, Andreas. Natalie or Rama, if you wanted to jump in, how are you navigating the financial aspect of, Natalie, for you, the post-bac? I mean, how did you navigate that? And thinking through like the financial aspect also of eventually applying to med school. So Natalie, any thoughts?
Yeah, so for my post-bac, I'm definitely taking out loans, which is unfortunate, but on pretext going to Brown, I got a full academic scholarship. So it kind of like put me in a more comfortable position to be like, okay, I'm okay with doing this and I can do this. And then while I was working, I would kind of do the same thing where I would put half of my paycheck on the side, like just to save me, because I do live at home. So I'm from New York and I'm studying in New York. So I'm living at home. So I take all public transportation every single day, which is rough at times, but it's not too bad. At least we have a good public transportation system. So that's kind of how I support myself through the program. And then I know for the MCAT and for applications, like we have like a linkage program, which is a bit different at Columbia. So it's an earlier application cycle. So it's different. I haven't gotten to like the application fees yet, but I know there's AMCAS has like a fee assistance program too, as well for your applications and also for the MCAT too. Just by the way as well.
Thanks, Natalie. Rama, did you have any insight on the financial aspect of applying?
Yeah, I'm happy that Natalie brought up the fee assistance program, because I feel like that's a program that is very helpful for a lot of students, especially students who come from lower income families. So the fee assistance program, or FAP program, supports, I don't know the exact criteria, but if you go on the AAMC's website, you'll see if you fit under the criteria that would allow you to get FAP. But once you have FAP, they bring down the MCAT fees. I think the MCAT's like $300, unfortunately, and I think FAP brings it down to $100, it's still a good amount of money, but it brings it down a little bit. And then I feel like where FAP is most helpful is when it comes to actually applying. The FAP program, at least when I applied, covers the first. So let's say you're applying to more than 20 schools, which often people do just to increase their chances of getting in. Then the first 20, at least when I applied, FAP fully covers. And then every school above that you pay, I don't remember exactly, but maybe it's like $20 per application for every school above that. But FAP will cover the first 20. And there's like primaries and secondaries. So FAP will cover the first 20 primaries, and then every other primary above that, you're paying like, let's say 20 per application. But secondaries are fully covered no matter like how many schools you go up to. So even if you apply to like 50, like all 50 of those should be covered, at least to my knowledge. And so that program is is very helpful. So definitely look it up because there are preferences in terms of when you apply, you would qualify for that cycle or not. Like I believe FAP extends until December or something like that. So you want to be able to apply at a point that would guarantee you to have that access for when you're taking the MCAT or applying. So definitely check it out. And also, at least for me, when it came time to apply to medical school, or even just thinking about application, I was always very nervous hearing about how financially burdensome it can be. But don't let that dissuade you. Like if you want to do medicine, stick to it. And I promise there are ways of making it more feasible. Like FAP is there, definitely not a solution, but I think it does help a lot. And then I feel like more medical schools are moving towards a model where it can be debt-free, it can be like fully covered depending on which medical schools you get into. So there are options out there. So don't let the financial burden scare you away from medicine if this is really what you want to do.
Thanks, Rama. So also the student asked, the second part of the question, the second part of this question from the student is, what helped you the most in guiding your application process without having close family members in the medical field? So anybody want to jump in and talk about that? If you didn't have someone in your immediate family that was a physician or a clinician of some kind in the in healthcare, who did you turn to? What resources did you have available to you?
I can go for this one.
Sure.
Yeah, I don't really have anyone in my family. I'm a first generation college student, and not many in my, I don't think anyone in my family is a physician. But I think a big thing is use your advisors and kind of like the career center, like at your college or at your master's program, wherever. Like I know people say that, but even like freshman year, I'd be like, oh yeah, like my advisor's there, and I wouldn't really use them, but use them. Like that's what they're there for. Like they're there to help you out, and they're there to advise you on what to do. So I remember specifically Jim Ampasher at Brown. I don't know if any of you have heard of him, but he works in the career center, career lab. And he was so useful and so patient with me in applying to my post-bac, in deciding to apply to my post-bac, and then in turn after that, even like post-graduation, he's still so helpful. And like, I'm like, can you please read over my personal statement? Can you do this? And he's like, so willing to help. So really take advantage of those resources that you have on campus. And then I think also what I've done is kind of gotten mentors. So like thoughtfully thinking about what positions or what kind of like research positions I want to apply to based on if it has like a mentorship aspect attached to it. So I work at Mount Sinai Beth Israel in New York City, and I get a mentor for the research I do. So I work under a doctor, and he luckily has been the most amazing person that I've gotten to work under, and he helps me. He's like, if you need anything with your personal statement, if you need anything on advice on how to apply, when to apply, like, please feel free to ask me any of these questions. So that mentorship has been super, super helpful. And then lastly, I would say the alumni network. So when I was at the beginning of this year, I was like, I still love sexual and reproductive health and like women's rights. So I reached out to a former Brown student who went to Brown Medical School as well. And then she started an NGO. I don't know if any of you have heard of it. It's called Saving Mothers, and it's an incredible organization. And so the doctor who runs the organization went to Brown. And so I reached out to her, and now I work with her. And then she's also super willing on like guiding me and helping me throughout this process as well. So I think really kind of using all of these different ramifications that you have at your grasp that sometimes we forget to use, or sometimes we just are like, no, I can do it by myself, and are kind of stubborn, at least I am, take advantage of those things.
Thank you, Natalie. That's really helpful. So again, find, the alumni networks, the career lab. There are definitely folks that I will say at Brown that really want to be supportive of your journey. Melissa, did you want to go next?
Yeah, so I'm not first gen. Both my parents are physicians, and they went to medical school, but they went to medical school in Ecuador, and you don't like apply, you just kind of go. Um, and that was back in the 80s. Um, and they were not like helpful to me in that sense of applying, because applying, when like talking to professors now, they all admit like if I applied now, I wouldn't get in, just because of the hurdles, like, you know, the hoops and everything they want us to perform to get to where we need to be. So they were my parents were definitely helpful in terms of like letting me know what it's like to be in med school and what it's like to be a physician, and like providing that. But in terms of like actually looking for application, I like application help, I definitely second what Natalie said about the career lab. I found help with that, although it was like sometimes hit or miss for me. But I was really fortunate that I was able to get a lot of help from friends of mine who were going straight through and had applied, because like we had been in the same class. So I asked a lot of my friends like how can I do this and this and this. Also, unfortunately, Reddit is a really helpful resource, like an incredibly helpful resource. I say unfortunately because it's really toxic. So just like look in there and really try to like parse out things. And a lot of what the information that Reddit is providing, like it's the pre-med subreddit specifically, it is really helpful. Just ignore the gunners and ignore like a lot of the like pre-med angst that goes through, because it'll make you feel bad, and just ignore it. They're just like people on the other side of the keyboards just like trying to make themselves feel better. But there is some useful resources, especially on the sidebar. So like I think that's my biggest advice, is try to like peruse through that and pick out the things you can, because they do have a lot of super helpful resources that I used. One thing I wouldn't suggest, that I know some people have done in the past, but I would not suggest it because I don't trust anyone on the internet. But they do offer opportunities for you to like share your like personal statement, and someone will like trade a personal statement and read yours and everything. Don't do that. I mean, you know, I believe in the good of people, like, and stuff like that. Don't do that. I don't know what they're going to do with that, and they could like use that and that could hurt you. But do trade with friends. I would find writing majors that would help me out and like read, so that like my story and narrative looked nice. And then I'd have, you know, for bigger things, I'd ask a friend who was a med student, oh, like, does this like the bigger thing of does it make sense why I want to be a doctor for that? Or like, does this make sense? They'd give it a read through, yes, no, and then we go from there. But those are the big things I can think of that really helped me in the process.
On that note, Melissa, just because another question was brought up around the personal statement, any tips for the personal statement? Just to follow up on what you just said, would love to hear any more advice on that matter.
Oh, absolutely. Yeah. So I think that the biggest mistake that I made with my first draft of a personal statement, and then I had to like scrap the whole thing and go through it again, is that I like the biggest thing to remember is make sure it is very clear what your narrative is. That, you know, how you get there is obviously important, but if at the end of it, it doesn't make sense why you would want to be a physician, it doesn't really put together, it's very cliched, basic things that you could think of all the time, then you haven't gotten to the main point. And if that gets lost, it's just not going to be helpful and not stand as like a good base for you for the rest of your secondaries. So I found I never outline my essays because I'm a terrible student, I guess. I started doing it in grad school, but I would highly suggest you outline and re-outline and re-outline, like really get that base super solid so you know where your story's going in a progression. And that once you get to the end, the committee can look at you and say, this is the type of student you are. This is their story to medicine. And this is why I want them to be at my school and why they want to be at mine, I guess. So I would say that's the biggest thing, really outline and make sure that it's clear why. It's clear that you're answering the question, because a lot of people don't answer the question, and I was one of them. And then I had to scrap my whole thing and start over, and it took forever.
Thanks, Melissa. Ray, your hand's raised. Did you have something to share too?
Yeah, I just realized I was muted. Yeah, I just wanted to, if I may interject and just kind of expand on what Melissa said in terms of my application process this year, because I am a reapplicant. And I think something that really helped me this second time I applied is from volunteering at the Rhode Island Free Clinic. I met some med students at Warren Albert there, and they were able to help me with my personal statement and the activities and all secondaries and all that. And what I really found valuable was when I had someone else look at it, they were able to see kind of the themes I was trying to convey across all of my application material and help me figure out and hone in on exactly what I'm trying to say and emphasize the parts that were really most important to my narrative. And that can be difficult to see on your own. So I just really recommend that for anyone that wants to apply. It doesn't have to be a medical student, it can be a close friend, but just trying to figure out the theme of your application can be very helpful.
Thanks, Ray. Other panelists want to jump in and talk a little bit more about any tips for personal statements for med school?
Yeah, I think having written personal statement for med school and for residency and now for a fellowship, I feel I've had my fair share. And having read just a ton of applications to residency specifically, because residents are involved in the application process as well. I think for me, probably the most important thing is, I don't know, I forget who said it, but kind of establishing your narrative. I think another piece is showing that you have a plan, like you have a plan for yourself. You know where you see yourself, what you want to do, who you want to be. It doesn't have to be fully fleshed out, but that you have an idea of the type of person. You don't have to say, I want to be an infectious disease doctor or whatever it is, but this is the focus that I hope to kind of cultivate in my work. And this is specifically why medicine will allow me to do that. And I think med school is a lot of things. It is an academic experience, it's a social experience, a cultural experience. And I think being able to write a little bit of kind of all the aspects of what medicine involves and kind of how medical school and medicine as a field will allow you to accomplish those things, or what you'll bring to kind of those multiple aspects of the field and of the experience. And so I think being as clear as possible as like, hey, this is who I am, this is what I want to do, and this is why you need me, rather than why I need you.
Thanks. Go. Did someone else want to chime in?
I'll just quickly add, like, when I finished my essay, I felt more confident about my decision to go to med school, because it, like, on the paper, it was very clear to me and the admissions committee, but to me, oh, these are the things I like about medicine. These are the things I want to do. And I like, that was a little surprising to me, was that, like, even once I had finished it and I knew it was a good completed product, I even felt like better about my decision going forward and more confident. So if it's giving you kind of that feeling, that's a very good thing, because that's what happened to me and I didn't think it was going to happen.
Thanks, Melissa. And my other question to that is, like, how personal do you get? How much do you share, right? I think you definitely want to check the boxes of, you have a plan, you know exactly why you want to get into medical school, the journey the path that you're on, but how personal do you get? Do you talk about yourself? And I think that's the balance that I think a lot of our students, including yourselves on the panel, have faced. So Ray, if you raised your hand, so go ahead, and I'd love to hear your thoughts.
Yeah, so definitely you want it to be personal to a certain extent. Like, you want it to be unique. It's about you. You don't want it to be kind of general, like, oh, like kind of anyone can write this, but up to a certain extent, because specifically I'm talking about mental health, because medicine is very rigorous and it can be very taxing. And if you come across as someone who's really struggling with mental health, it can be a red flag, like, oh, is this person going to be able to handle medical school? So if you like read on Reddit or Student Doctor Network, you may hear people talk about, don't write about mental health. I happen to, but the thing is, I would recommend making sure you emphasize like, oh, this is what happened, but move on to, hey, this is how I've grown from it, and especially like how it's helped shape my journey to medicine. Like focus on that latter part over what you struggled with, because you
Mhm.
want to paint yourself as someone who's ready for medical school.
That's really helpful, Raymond.
Yeah, I will add to that because I think that's one of the biggest shames of medicine. I have a lot of gripes with the medical school application process, and I don't have time to go into all of them. It is a huge shame. Mental health and mental health advocacy is a huge, huge part of my story, and having those struggles. And I think that normalizing it, like I can very openly say, like, I struggled a lot with this, like, intense pressures that were placed on me to get into medical school. So if you feel that's happening, know that you're not alone. That happens. I also made the decision, I'm not going to share this as part of my story that's going to be included, even though it's a huge part, because personally, like, that's mine. I'm happy to share that with my friends. I don't trust that admissions committees will handle that with the same respect. It is completely up to you if you decide to share that part of you. But I would say, yeah, definitely what Ray said, which was like, focus, don't get so much into the weeds of it, and focus more about kind of how that contributed to your journey to medicine and how you overcame it. Even though I think that is ridiculous, because we are constantly working with mental health and like maintaining mental health. So I don't want that to dissuade anyone or feel like they cannot be struggling with mental wellness and be applying to med school, because that is absolutely not true. But definitely be cautious with it. And I definitely was, and I chose not to because it's just something that I didn't feel comfortable with.
Thanks. Thank you, Melissa, for just being really honest about that. And it is a shame. And we do definitely need to work on that, even in public health, I'll say, to make sure that we honor people that are sharing and being vulnerable around their mental health, and actually, seeing that as a strength in terms of being able to share it. So in the last 15 minutes, one of the students also asked, if you were able to speak to your younger self, what is one piece of advice you'd give yourself to prepare for applying to med school? Could I turn to Maria for some initial thoughts?
Yeah, I think I have something to say that kind of wraps up like the last three questions because I didn't answer them. So in everything that I do, quite literally everything that I do, I ask myself, before I say yes to the thing or no to the thing, I'm like, is this moving me closer to the person that I want to be? So that was, I think, to Andreas's point earlier about how, and that's just really like the thing that guides me in what I decide to do and not do. And that included shaping my personal statement. I think that it's helpful to frame the personal statement as not why you want to go into medicine, but like when you think of the reasons, yeah, they might be the things that got you into medicine, but I think what's also helpful is to consider, will those reasons be the reasons that will help you stay when it gets really hard, when you want to quit so bad? Not because it's not like medicine is always awful. It's just that sometimes it gets really hard and you will be challenged. And when we are challenged, sometimes we want to get out. So when you look back, so actually this was a piece of advice that Jen gave me. She said, take a personal statement, and when times get tough, just look at it and remember why you're doing all of this. In my personal statement, I did get personal, and I had to sit and say, do I feel comfortable having my letter writers read this about me? And that was also like, it's a huge level of trust for the people who know me, and also a huge level of trust for the people who don't. But I had the attitude of like, I'm going to own the story that I have. And I want to say that, like, I think there's a temptation sometimes in the pre-med world to like leverage your like traumatic experiences and put them down on paper. But I want to remind everyone that like your traumatic experiences are not the only places from where you've experienced growth. And so if you're not in a place to write about those, don't. And I think the other question was, what helped you most in guiding your application process? Things like my personal statement would not have come so, I wrote it all in one plane ride to like, and across the country. So it was a long plane ride. But one of the reasons why it was I was able to do it in one sitting was because I very much relied on my friends. I picked and chose like what types of questions to bring to my friends, because I could tell that, you know, some of them were pre-med and I was like, well, some of them are really great at this thing or that thing. Let me get their opinions on that. Because they are also, because they're some of my most trusted people. They can always tell when I am not being completely honest with myself, or if I'm maybe stretching things or not showcasing enough of my own things. So they were a really great temperature check for my application process as well.
Thanks, Maria. Any other folks on the panel that want to speak to their younger self? What piece of advice would they give?
I can go.
Sure.
Mine's a bit more broad, but I think what has really helped me throughout this whole process is that there are no timelines. Like they don't exist. You kind of just make them in your head, and you have this expectation that I have to do this, and then I have to do this, and then this, and this, and this. And then finally, by the age of 45, I'll be doing this, this, and this. No, like it doesn't exist. And once you become comfortable with that, I think things do become a bit easier, and you get to actually enjoy the process, which is actually very nice. And secondly, I would say comparison is the thief of joy. So do not compare yourself to other people. Like you're your own person. You're doing this. You're in the places you're supposed to be for a reason. And so I know it's very difficult, especially in this environment, but try your best not to compare yourself to others.
Love that, Natalie. Thank you.
And stay off that part of Reddit and Student Doctor Network. Anytime like you're tempted, just don't do it, because I mean, at least for me, it affected my mental health. Just wondering like, oh, these people got interview invitations already. These people got accepted already. Like, when is it my turn? Like, am I gonna get in? Just don't go down that rabbit hole.
Does Student Doctor Network still exist? Is that still a thing?
Yeah, like worse
like
than,
generations? Okay. Good.
worse than ever. Like it's terrible. Like somehow Reddit's even better. Like it's better than Student Doctor Network, and that's not saying much. But I guess like very quickly what I would say to myself, and like it's everything that everyone else said. Yeah. But I think I would have just told myself like it'll be okay, for one, but for two, that there's only so much you can give of yourself before there's nothing else left, and it's not you. So I would just like really push myself to just not compromise on the things that bring me joy, that make me me, and that because I'm gonna have to keep making those decisions for the rest of my life, so why would I start cutting things from me now?
Also, thank you.
Does anyone in the audience have any quick questions before we conclude? Just want to open it up real quick.
Or feel free to type it in also. In the interim, well, if you're thinking about it, I do want to also ask the question about being a first generation, either med student, grad student, med student in the United States, first gen undergrad. Can you speak a little about that? I mean, I know, so I'm also first gen, and I definitely, the way that I've viewed my life's work is to make sure that I continue to open those doors for those students that are similar, have a similar history or similar life experience. And how have you navigated as a first gen? I mean, there was part of me when I was younger that didn't just wanted to blend in, didn't really talk about my history, didn't talk about being first generation. And I just think, let's own it. I mean, there's something, I'm very proud to be standing on my parents' shoulders and getting to where I am. And I'm just wondering if any of you wanted to share a little bit about your first gen story. Anyone?
I can go.
Sure.
It's definitely difficult at times, not gonna lie. But I think it's definitely a very big motivating factor. So I particularly I'm Latin, like Latina, and I choose to work in environments, especially like my clinical experiences, where there's Latin populations. And then that's a big thing. So I always want to give back. And then a second thing is that there's, I think 4% of doctors in the United States are Hispanic, or 4% are female Hispanic doctors, actually. So I want to be one of those so I can motivate other young kids to also raise the percentage.
Thanks, Maria. Thanks, Natalie. Sorry for saying that. I really appreciate it. Any other comments or thoughts?
I mean, just to resound what you were saying, Jen, I think, like, as many of us know, being a first gen or you know, I say that I hail from an immigrant family. I immigrated to the United States when I was 12, and like, I've been enrolling myself in school since I was like 12 years old, you guys, 13 years old. And so I had to get really savvy really quick on how to use my resources. I mean, but it's also, I'm in this weird in-between place where my dad was a physician in the Philippines. So I don't know why that didn't translate here, but I think that like, you will offer such an important voice at the table with the insights that you have, and like, I just, you don't, there's no room to undercount that, especially when we know that in pretty much every med school class, half of them are white, right? And like, well, I guess that doesn't necessarily mean they're not immigrants or anything, or first gen, but never undercount your own voice just because you might be the only one. If anything, that increases your value and your importance. So I think that's worth remembering.
Thanks, Maria. Any other thoughts? Anything else anybody else wants to share?
Yeah, I'll say something. So I'm not a first generation college student, but I'm a first generation physician. My sister and I are 16 months apart, and we both applied to medical school as the first people in our family, kind of like around the same time. So we both struggled through that process with each other. So this is kind of answering the previous question. We were just figuring it out blindly, no clue. My parents had no idea. And even now, like she's graduating, she's going to fellowship, I'm graduating residency. My parents are like, we know even less about how to help you now than we did before. So good luck. And there's some beauty to that. There's a lot of beauty to just figuring it out. And it also feels in some way less there. It felt like there was less pressure. It felt like, hey, you don't know, you're just doing it. And if you get to where you're going and you're trying to go, wonderful. And if you take a little bit of a detour, that's fine. You're figuring it out. And so I think having some, like honoring that a little bit is important, and honoring your own creativity, and in terms of how you constructed your own path. I think it's important to give yourself that credit, because you got there on your own, or you figured out how to use your resources to get yourself there, and the people around you, and the people who have supported you. So it's a win, as some others have alluded to, for everybody. And when you look back on your former self, you're just like, wow, you were like 21 years old and had no idea about any of this, and now you're a physician, and you're taking care of people, you're taking care of family, you're taking care of whole communities, and that's important. So it's fine to not know what you're doing, and it's fine to make mistakes, which is also what I would tell my younger self. Probably make more mistakes and have more fun.
Thank you.
Looks like we
Ray?
just got a question in the chat. See.
Okay. Is there, if some folks can stay online for just a little longer, is there plan A med or plan B non-med type of planning required? Any thoughts? I'm wondering, is that, I don't know if you want to speak to that, Haridas, about if you want to clarify that.
Yeah, I'm just trying to see, I know everyone here discussing about med, but do they had any plan? Suppose I had to prepare for med, and if in case did not get through the med, what are my plan B options?
Okay. Anyone? Yeah, Melissa?
Yeah, so my plan B was to just apply again. I think there was like a limit I had set for how many times I'd apply, but once I found public health, yeah, like I would apply again because there's plenty of reapplicants, like tons of them, and it's not an uncommon thing. So it was definitely to apply again. Let's say like all that, and then I'm like, I hate medicine, I don't want to do this, whatever. I found like a very great joy out of public health. Like I really, really loved it. And I'm very fortunate that getting a master's in public health, it can be considered a terminal degree. So I did consider that a plan B, that if like nothing works at all, I can work for a few years and then think about maybe pursuing a PhD or something. Or doing something else that's kind of like tangentially related to medicine, like research. But yeah, I was pretty confident that I wanted to do medicine and that I'd do like quite a bit to get to that point, because I had already done quite a bit to get to the point of applying. So it wasn't like med or bust, but it was definitely like, I will try to an extent, and then here are some other things, but they also bring me joy.
I'd like to say, especially as someone who had to apply twice, the second time around, I really was very, very intentional about curating a very specific and yet overarching purpose in my work and what that meant for me. And again, like making that purpose the reason why I stay in my line of work. And so when I was able to think of specifically the reasons why I want, like what my life's purpose was, it allowed me to view the medical path as just a path. It is one way to get to what it is that I want to do and to help the people that I want to help and to serve the communities I want to serve. And that took so much of the edge off, because then I was like, oh my gosh, right. I have skills and thoughts and ideas, and I have options. If this path does not work out, yeah, I could take a different angle into manifesting the purpose that I have realized or set for myself. And so that allowed me a lot of flexibility in terms of how it was that I wanted to create like my career trajectory. So to answer your question, it's yes, but I wouldn't get stuck on like, I'm on track A or I'm on track B or nothing. It's more of how do those tracks speak to what you want to do and why you want to do it.
Thanks, Maria. I know we're about at time, so I just wanted to, unless any last thoughts? All right, so I wanted to just first thank the panelists, Natalie, Maria, Andreas, Rahma, Melissa, for joining us today on behalf of me and Raymond. We really want to thank you for taking the time to demystify how to, this journey into medical school, and for being vulnerable, being open, talking about, the ups and downs and challenges, and just being very honest about your path. It's really helpful. This alone, just sharing this, it's helpful for students that are on the call now, or will also listen to this call later, and just making them feel less alone around this process, that there are peers and former Brown alum that you can reach out to. You can definitely reach out to me as well as Raymond, and to other panelists. I hope that just to know that you have a support system at Brown, but also that students from Brown University have gone on to medical school, have gone on to a post-bac, have gone on to residency, and that many of us are first gens and we have figured it out. Yes, it has been challenging, as Natalie has said. It isn't, we can't understate that, but also at the same time, Andreas, the point of like, wow, like I did this, I figured it out. And yeah, like when I was 20, I didn't know what the heck I was doing. I was trying to like one foot in front of the other. For me, tended to find faculty and peers and resources that I just like held on to, because I knew I wanted a big life. I wanted something more. Not that, my family they worked so hard for us to get to this country that it was just like, I just wanted to take advantage of all the opportunities. And it was just, there are people at the university that really want to open doors for you, really want to spend time with you to help figure that path out. So I just wanted to thank everybody. And then some of you are putting your emails in the chat. The panelists, their bios were also part of the announcement. So feel free to read through their bios, and feel free to connect to any of us. But thank you again. Just thank you to the panelists, also to the people that were able to join our call, and just know that we're here, and that was really helpful for all of you to be so open and honest and to talk with us and spend time with us today.